Hey guys, this is Dr. Joe Borio, and I wanted to review some cases with you guys on a weekly basis or even more frequent. And today was a great case that I'm working with a young woman, and her medical doctor, she had seen her medical doctor for some health problems. Primarily she was getting some headaches. She was having a chronic history of allergies. Sometimes she'd have difficulty just concentrating, as she kind of explained it, almost where she felt kind of foggy. So she had gone through a lot of testing, and she had gone to her medical doctor, and then she had gone to a neurologist, and getting some medications. And I'm not trying to knock that, there's a place for that, obviously. But what was disappointing for her, and I find this so disappointing to the public in general, is that both her neurologist and her family doctor, who I'm sure are wonderful people and they want to help her, and they both said, don't go to a chiropractor. And so she was under the trust of them, and she said, okay, I'm not going to go to the chiropractor. So this is something that she's dealing with for years. And she's at work, and there's two of her coworkers that are patients or practice members of ours. So they come in and they receive chiropractic care, and it had made an enormous difference in their overall health. So they said, listen, go see Dr. Borio. He's a chiropractor. So she ended up coming in, I think, nervous, reluctant, never been to a chiropractor before, didn't really know much about what we do. And yet she said, hey, listen, I've been doing this, so-called traditional or more medical approach, and it wasn't helping me. And I'm going to go see Dr. Joe Borio. So she came in to see us, and this is her neck x-ray. So before I go over that, I want to go over this really quick. These are the different phases of damage that people can have in their neck. And this is the one I want us to pay particular attention to. This is the normal or healthy neck. And you're going to notice here the head is over the shoulders. There's a beautiful curve in the neck. And it's just really healthy. So that's what our normal healthy neck should look like. And then when we look at her neck, and she's such a beautiful young woman here, and you're going to see she has no curvature in her neck at all. Zero curvature in her neck. Probably born like that. 11% of the population is born with no curvature in your neck. So now what's happening? Her spine is out of alignment, right? So it's not in good alignment. It's kind of like having crooked teeth, right? Think about, you're born with crooked teeth. So now these vertebrae are out of alignment, things that I talk to you guys a lot about. And then it presses on these nerves. So, you think about it, why would it affect these other systems? So let's look at our nerve chart. When we come over here, and this is something I've gone over with you guys before, there's our spine, there's our brain, and these are all the organs through the body, right? So when you look at this, where these go, geez, guess what? Spine's out of alignment, it's going to affect brain function. Science says it's going to affect my ability to have cognitive skills, problem solving. So we already know that when the spine is sick, your brain gets sick, doesn't work as well. We know that it's going to contribute to headaches, which she's got. We know it's going to contribute to allergies because the upper part of the spine where those nerves come out are being pressed on, right? So again, using this example, your spinal nerves are just like this. They're wires that come out of your body. And when those wires get pressed on, then the life, the health, the healing, the communication doesn't get where it's supposed to go, and this is what happens to this young girl. She's getting sick. So she starts getting care, and in a matter of 2 months that pass, guess what? Great story, right? She's not getting headaches anymore. Her allergies or breathing have dramatically improved. Her, what we call cognitive skill, her ability to concentrate, I think is the easiest way to say it, has dramatically and significantly improved. So her entire quality of life is better. So she's in today, we're having a conversation with her on a checkup, and she's just, Dr. Joe, the care you've provided has made a dramatic and significant improvement in my life. And I'm frustrated. And I said, well, geez, Kaylin, why are you upset? And she said, you know why I'm upset? Because I had asked my medical doctors several times about going to the chiropractor, and both of them, not one of them, both of them said, no, don't go to the chiropractor. She says, I've seen you for 2 months. I've spent nothing compared to what I was spending, the thousands of dollars that I've already spent over the last 7, 8 years. And she said, and I feel better now than I ever remember feeling since I was a teenager. And I'm very upset that, one, I could have felt this good years ago. And two, people that I trusted, people that are in the medical field, told me not to go. Why is that the case? Right? And this is where I would go with it. I see a lot of medical doctors as patients in our office. And unfortunately, those in the medical field know virtually nothing about what a chiropractor does to this day. And that's tragic. Now, to be fair, I don't know the latest technique on removing an appendix or doing cardiothoracic surgery, because as a doctor in my field, that's not something I do. So I don't study that. It's not something that I perform. It's not something within my scope of practice and scope of my degree, right? So to be fair, I would say that's accurate. I wouldn't know the most. I wouldn't be the expert, the go-to person. But here's the reality. You wouldn't ask your dentist about cardiothoracic surgery, and vice versa. You wouldn't ask your cardiothoracic surgeon about your teeth for the most part, right? I mean, a dentist has his or her place in taking care of their teeth or your teeth, and the heart doctor, the cardiologist, takes care of this part of the body, and the gastro takes care of this part of the body. So to be fair, that's where they focus their attention. But to drive that back, they don't know about the spine. They don't know about the nervous system in the spine. They don't know really anything about what a chiropractor does and how powerful it is and how beneficial it is and how people should go regularly. So what bothers me, and I do the best I can with videos and lectures, is what bothers me is they tend to have an opinion and they offer that with patients when they really are not the expert. They're not the expert. They don't have the training to even render an opinion on whether or not you should go to a chiropractor. There's only one person that has that opinion, and that would be a chiropractor. Now, here's the reality. Saying, should I go to a chiropractor, is kind of like going to a dentist saying, should I go to the dentist? I mean, of course, everyone should brush and floss their teeth and go to a dentist. So everyone has a spine, and the spine needs to be taken care of like your teeth. So everyone should go to the chiropractor. But the problem is the medical field doesn't do education or training on the spine or the nervous system. So you got to remember, a chiropractor goes to school focused solely on the spine and the nervous system. So, whether it's a pediatrician, you're asking about bringing your child to care, they're the wrong people to ask, because they don't have the training, they don't have the knowledge, they don't have the degree, they don't have the expertise in really rendering an opinion of what a chiropractor does, or whether or not it's going to benefit a condition, or whether or not you should go. There's only one person or one profession to have that discussion with, and that's a chiropractor. Like, I would never tell you, about a tooth problem, because that's not what I do. I'd say, hey, listen, I'm going to recommend a really good dentist, right? And if I saw that you had a surgical issue problem with your knee, I'm going to send you to the best orthopedic, and he or she's going to render the opinion on the knee, right? Not me, because that's not what I do. But when it comes to the spine, when it comes to the health of the spine, only a chiropractor will render an opinion. A couple other things too. If you have a bulging, I hear people say I got a bulging disc or herniated disc, or I've had some prior surgery in my spine. That I see people that have, and when I say people, I mean thousands of people. They have rods, screws, fusions. I see people with herniations in their spine and bulges in their spine, stenosis, spondylosis, the degenerative deterioration that's occurring in their spine. The reason that most people have that is because the spine hasn't been cared for in the first place. So if you don't brush your teeth, you're going to get rotten teeth. If you don't take care of your spine, it's going to get rotten. And that rotten means arthritic, and that means stenosis and spondylosis, and the disc is going to bulge, and the discs are going to, and you're going to grow spurring. And the disc will herniate. But that doesn't mean not to go to the chiropractor. That means, in fact, I'd say just the opposite, that as a chiropractor that renders care to these people, and maybe that's you listening, that the most impactful person to go to is the chiropractor. Now, that doesn't mean you still might not need surgery, but to take care of the spine is the best way to take care of those vertebrae and those discs and those joints and those nerves. Just like brushing your teeth is the best way to take care of your gums and your enamel, right? And your molars and your bicuspids, same idea, no different. So the question is, if your medical doctor told you not to go, I don't even know that I asked that question, but if they did, maybe a few questions would be, well, what do you really know about chiropractic? And did you go to school to be a chiropractor? Well, why do you feel as though you're qualified to render an opinion on a chiropractor when I wouldn't ask my chiropractor what he or she thought of a medical procedure, because that's not what they do. And I think that's really the realistic part of it. I get a broken heart in reality when I look at the number of people that are out there that aren't getting care, and the amount of people that are taking drugs, and the amount of people that are utilizing surgery or injections within the spine. And I'm not saying that never is necessary, and I'm not saying that should never be done. But where my heart gets heavy is the number, and I mean thousands to millions of people that are not getting care, that there's so much hope and benefit for them if they would go to their local chiropractor and get adjusted. Get their spine checked, find out where it's crooked, and get adjusted. Listen, here's the reality. There is never health in crooked. There's no health in crooked. I mean, I think the average person, if you show them a crooked spine and a straight spine, they're all going to say the straighter spine person is healthier in multiple ways. And the job of a chiropractor, number one, is to get you straight. Number two is to keep you straight throughout your lifetime. And that's primarily so the spine doesn't rot, and the messages of life, health, and healing, those messages, those electrical messages of life that your brain sends through your spine, that all those messages can get there and go to your body like they're supposed to. That's the benefit of going to a chiropractor. So simply put, you go find a great chiropractor, all of you that are listening. Get a great chiropractor. Find somebody that he or she cares about you, put your interest ahead, and really is going to take care of you. Number one. Number two, eat well. Number three, stay moving. And if you do those three things, I probably had, and I'm going off the top of my head, 20 90-plus-year-olds in my office today, all of which I've been seeing 20-plus years. And they all say, you know what, Dr. Joe, seeing you and listening to you and taking care of my body like you've taught me have made a dramatic difference in my life. And it's because of you I'm up at 90 years old. And I live a good quality of life. That's what I want for you. I don't have an ulterior motive. I got one motive: to give you the best quality life that I can, with the utilization of less drugs or less surgery, so you're healthy, so you're functioning, so that when you're 80, 90 plus, 100 years old, you can have a relationship with your grandkids, not be in some room with tubes sticking out of you, not remembering who you are, and not living any quality of life. That's what our role is. That's what we focus on here in our office, to give you all a better life. Listen, I love and appreciate you guys. I'm in Cicero, New York. I'm in Central New York, just out of Syracuse. And I've had, 100 people over the last few weeks since I've been doing these videos. They've been asking me, hey, Doc, who do you know? So listen, if you're listening to this and you're like, I don't live anywhere near this guy, and I appreciate that, I want to help you out. So reach out to me. Let me know where you live. I know a lot of docs across the country. I would literally love to have the opportunity to refer you to somebody really good that's going to take great care of you, to offer you a better, healthier life. Hey man, love and appreciate you guys. I'm Dr. Joe Borio, Cicero, New York. Love to take great care of you. Love to have you part of our practice. Love to allow you to live the chiropractic lifestyle. Until next week, guys. Talk to you next week.